My name is Yahir Santiago-Lastra, and I am a urologist, urogynecologist, and the director of the Women's Pelvic Medicine Center. Many patients ask, what exactly are pelvic floor disorders? Well, the pelvic floor is composed of an intricate network of connective tissue, ligaments, muscles, nerves that all come together to support structures like the bladder, the vagina, and the rectum. And whenever any of these structures is not working in complete harmony with the rest, a lot of symptoms can result. Typical disorders that comprise this umbrella term of pelvic floor disorders include urinary incontinence, fecal incontinence, and pelvic organ prolapse. And typically, patients who are experiencing these symptoms will complain of urinary incontinence, urinary urgency, and other symptoms, constipation, a feeling of a bulge in their vagina or their pelvic floor. And this can lead them to other symptoms like infections that prompt them to seek medical care. One big misconception about pelvic floor disorders is that it's completely normal to experience these symptoms after childbirth, when in fact urinary incontinence and pain, and for example pain with intercourse, are not normal to experience after childbirth. Another common myth is that pelvic floor disorders are a woman's problem, when in fact a lot of men can experience these symptoms as well. The third most common myth that I see regarding pelvic floor disorders is that it's all related to a weakened pelvic floor. And a lot of patients think that Kegel exercises are going to be a cure for all of these symptoms, when in fact, sometimes the opposite can be true. The problem can be related to a tightness of the pelvic floor that causes pain, and physical therapy can often be helpful in that symptom. Some ways to improve your bladder health include drinking the right amount of fluids. And the most important fluid to consume for your bladder is water. Typically, we recommend around 64 ounces of fluid a day, which roughly is equivalent to about 8 cups of water per day. But always remember that eating fruits and veggies that are high in water content also count towards that goal. If you are a kidney stone patient, you should probably elevate that requirement to around 100 ounces of water, and it's always good to put a little bit of lemon and baking soda in that water to help prevent stones. Another thing you can do to improve your bladder health is to quit smoking or to never take up smoking. Smoking is a really important risk factor for bladder cancer and other pelvic floor disorders, so smoking cessation is going to go a long way to help with your bladder health. A diet that's rich in vegetables, whole grains, and protein is really excellent to improve your overall bladder health, and very important in that is to avoid constipation by eating a lot of fiber. Lastly, to improve your bladder health, also do your pelvic floor exercises and give yourself the right amount of time to go to the restroom and empty your bladder and your bowels on your schedule. A lot of my colleagues will ask, when should patients seek help from an expert? And oftentimes, people just don't feel comfortable seeking advice from an expert because they're embarrassed. In fact, millions of people with pelvic floor disorders do not seek treatment for a long time. If you have a pelvic floor problem or are experiencing symptoms that are bothersome to you, even though they might be embarrassing, a pelvic floor expert can help. What a lot of patients don't realize is that there are a variety of treatments available, from non-invasive treatments that just deal with helping you with your own behaviors, to pelvic floor physical therapy, minimally invasive surgical options, and also many medications available to help treat the symptoms. So if you feel like you're experiencing symptoms related to your bladder or to your pelvic floor, don't hesitate to seek help. If you're a patient and would like to get involved in research in this field, UC San Diego Health has partnered with the National Institutes of Health in their Prevention of Lower Urinary Tract Symptoms Consortium, or PLUS Consortium. This study has a really unique research mission and goal, which is to identify factors associated with bladder health and pelvic floor health, with the ultimate goal of preventing lower urinary tract symptoms in girls, young women.